Hello, good evening. If you're joining live for the very first time, I say welcome. Sniffy Bob, good evening. How are you today? Good evening. Tracy, welcome to the live. Please indicate to your colleagues or to your indicate to your colleagues so that they should come to indicate to your colleagues so that they should come on live early enough. I'm sorry for the late live today. I was supposed to start at 7:30, but I had a problem with network, so I think I still have a problem with network. How was your day there? I was supposed to tag you to the live video, but it happens that I forgot. It is when I saw you coming in that I was like, ooh, I forgot to tag you. Good evening, Tracy. Please indicate in class that others should come on live. So how was your day? You're welcome to my live. Good evening, Big Sis. How was work today? I hope you had a peaceful day at work. Yeah, you're back, Sniffy Bob. I hope you saw my subscription. Yesterday, Sniffy Bob, you're having 29 subscribers, and I'm the number 30. I think people are finding it difficult to join. They are disturbing inside my WhatsApp. Please, Sniffy Bob, help me. Is the video having a restriction? Because the students are complaining that they can't come in. They are being restricted. How was your day? How was your day at work? My day was okay. We thank God. It was a very busy day, but as long as God gives the strength, who are we to say no? Nurse Aisha's eyes full closed, wide hacky. Akash, good evening. Welcome to my live. As you're joining, please take some few seconds to share the video. Today we are going to be giving lectures to the nursing students on how to do a report writing on how to do a report writing and equally how to do planification, how to plan for treatment, and we'll talk about ectopic pregnancy in length. Then we'll read presentations of patients to the doctor. Please share the live video so that others can join. Sniff Bob, is the live video restricted? I don't understand why the students are finding it difficult to join. They said the live video is restricted. Varam, good evening. I called you yesterday and called. It showed that you had left, so I thought you had slept already. Hey, ma'am, may I come in? Come right in there. Come right in and sit just at my right hand. Good evening, good evening. How are you today? How was your day? How was school today? I hope you had a lovely day at school. Please share the video. I don't know if my video is restricted. Please help me if the video is restricted so that I restart the live. Because my students are complaining that they can't get into class. They said the video is restricted. I don't know if it's restricted or not. You can best tell me if it is private mode. Welcome to my life. If you're joining for the very first time, I'm Nurse Aisha, and today we are going to be talking on how patience. Good evening, Nurse Aisha. Good evening, patience. So I guess you guys are connected now. Madame, bonsoir. Personnels ne sont pas connectés. Pourquoi? Beaucoup de personnels ne sont pas connectés. Pourquoi? Je devais vous devenir de connecter à l'heure. It's not private mode. Thank you so very much. Because when they said the video was restricted, I thought I had put it on private mode. Good evening. Please, patience. Tracy, as you're coming in, share the live video on all platforms so that other nurses can be able to study. Ndomo, good evening. How are you? How are you this evening? I hope you guys find time to eat before this live, because I barely had something to eat, but I ate though. Good evening, Ma. It's Dora. Good evening, Dora. How are you doing? I hope you're fine this evening. The topic today is we are going to be talking lengthy on ectopic pregnancy. That is diagnosis, signs and symptoms, nurse management, pre and post management of patients with ectopic pregnancy. We're equally going to be looking at report writing at the level of nurses. We are going to be looking at planification of medications. We are going to talk about consultations. So I get Veram, consultations is going to be something you might be interested in. As much as consultations are for doctors, we equally have nurses consultation as well as diagnosing. Good evening, Rafaela. Welcome. I hope if you're joining me for the very first time, I'm Nurse Aisha. Please, as much as I'm a nurse, I'm a young YouTuber, and here is a space for the young YouTubers to grow. Okay, ma'am, really good topic for gynecologists. Yes, very good topic for gynecologists. And a better one for surgeons, and a better one for medical practitioners. Because you never can tell when you have a situation whereby you have to diagnose and to give orders. The students wanted us to talk about this topic because we already have some few cases days back, and we think that it is necessary that they understand how best it is to handle these patients. Good evening. I'm Nurse Aisha. Please, if you're joining my live for the very first time, welcome. Here we talk on nursing. Somebody asked me yesterday, what are you selling? I'm selling knowledge, and it's free. So if you want to join the live video, if you are watching the live without commenting, I want to say I'm grateful. Please do not forget to like. Didi, peace and love from Houston, Texas. Didi, good evening. How are you doing? Yesterday I shared my love with you. I realized that you were having 3 subscribers, and now I'm your 4th subscriber. I hope you saw it. Didi, good afternoon. Good afternoon from Houston, Texas. Please, Didi is a young YouTuber and his numbers are still low. Let's just show him some love. Exactly. Knowledge. I always say health promotion is free, but the thing that is not free is treatment and rehabilitation. So when you get into a situation where you want to have free knowledge, it is better you keep it on. Dora, please try to count the number of students that are in class. We are supposed to be 8 and above. So if we get to 5, let me know so that I start. I'm waiting for you guys. Share the live video. If you're here for the first time, please comment and subscribe. If you're a new YouTuber and you want me to give you a shout out, just go ahead and I'll give you a shout out. If you are subscribing, if you subscribe to my channel and you're a new YouTuber, I'm going to share that same amount of love. We are having here Tanji Gang. Tanji Gang. He was 34. He had 34 subscribers. I subscribed to his channel this morning, and he's now having 30. Sniffy Bob was 29 subscribers, and I subscribed to his channel, and now he is having 30. Please, Sniffy Bob is a young YouTuber. Let's go show him some love. Let's take him to 50 today. I equally have Merrick C. Marik was having 5 subscribers. I subscribed to his channel, so he's now having 6. I know that some people might not necessarily have the subscriptions because they wanted to start a YouTube channel, but I tell you, nothing happens for nothing. If you start having subscriptions, that simply means the Lord is about telling you something. So why not start? Yes, I know all the big YouTubers are telling young YouTubers, you are doing this wrong, you are doing this wrong, the things you should be doing right, the things you should be doing left. We are here so that we can grow. We've learned all those strategies and we've implemented 1,000 of them, but I'm not sure any of that helped anybody. Or probably did. I should not speak for everybody. But the young YouTubers, we equally have a say. We equally want a wall of our own that we feel safe. I don't want the pressure, and I'm sure people who do not want the pressure. Let's take each day per time, each step, and see into it that we grow together. So if you're a young YouTuber, please subscribe. Immediately I see your subscription in my email, I'm going to check back your channel. And if you subscribe to my channel, I'm going to refund the love. I subscribe to Chelsea Jones. Chelsea Jones was having 30 subscribers, and I'm number 31. I equally subscribe to Wellness with Didi. She had 5 subscribers, and I'm number 16. So yes, I want every young YouTuber, if you have just one subscriber, come on live. Let's give a shout out and take those subscribers to 10. Come on live and let's take those subscribers to 10. If you're having 2 subscribers, come on live and let's take those subscribers to 20. It is very important that we grow together. Let's create this community in such a way that by the end of the month, we too can say, shout out, I was monetized. I have been monetized. I am left with 200 hours to be monetized. We want that kind of jubilation. There are so many young YouTubers that start their channel and then within few days, they stop, they quit. The struggle is real. Just like the TikTokers come on live and encourage each and every young TikToker to grow their channel. That is what I want to do. I want to come on live every day and encourage those that have dreams, aspirations to become YouTubers to go ahead and dream. There is no harm in dreaming. My name is Aisa. If you're coming on my live for the very first time, please take a seat at the comment section. Say hi so that I might greet you from your region of origin. If you're coming from India, if you're watching from China, if you're watching from Bangladesh, if you're watching from America, if you're watching from Germany, from the UK, if you're watching from Nigeria, if you're watching from South Africa, Kenya, Ethiopia, I want to say thank you so very much for joining. and welcome to my life. What a pleasant surprise to have you here, and I'm so blessed. If I have just two people on live, I'll keep talking because it makes me happy. It is like that new baby step that you are trying to take. Each time a child tries to walk and realize that they can stand on their own, they become so overwhelmed and carried on that the only thing they want to do is walk. That is just how much I have identified myself. Today is just my third day of coming life. And I tell you, I'm loving every second of it. And every day, I just want to come life. I just dream of the moment I'll be here because I want to build a true community. I want to look at my comment section. I'm like, yes, this is Veram. I know already. I want to say this is Gigi. I know already. I want to build a community not just for myself, but for you. Sorry, the network will always keep disturbing. We are in Africa. Everything here is done. Whether we are going up or we are coming down, we are going to just keep working with it. Because if you are waiting for a perfect environment to start that dream of yours, it will never be realized. I just want you to know that when I started this, I thought that I wanted to start my YouTube in 2019, and I did not. 2020, I did not. 2021, I did not. 2022, I did not. 2023, I did not. 2024, I decided it was time. Yes, delay is not denial. So I might have delayed, I did not deny myself. So now that I found myself, I want to take that walk and take it boldly. You too can be the next person. Deborah, Deborah, if you're on live, leave a comment so that I know that we are starting. Today we are going to report writing. Student nurse, you don't really what all that is, how to manage it. It becomes overwhelming, and the question is, how do I find myself in the midst of professionals that already know what they are doing? How do I get to understand what they are doing? And if you get to a very busy hospital where everything is a mad rush, it might be so frustrating. Like, okay, you know what, I believe that I might not be able to learn this. There are many nurses, especially the level 1 nurses, that when they start going for internship, that is when they realize nursing is not for me, because we make it so complicated. It's just like it's a one-man squad. Every other person is moving like a mad person and nobody says anything. That is because you already know what you are looking for. That is because you already know what you are looking for, and the individual that is close to you does not. If you are not free, if you are not busy, if you are not less busy, you might find it very difficult to explain to them. So today I want to take up this moment to talk with the students that are on internship in my place of work, so that they too can be on board, so that we don't just move and allow them behind. We want to move together. Nursing is not just about me, it's not just about you, it's not just about coming to the hospital taking care of patients, but we are equally trying to create a safe zone that if I get old and I cannot walk, who will take care of me? So I need to leave that legacy. I need to keep that footprint to be sure that the community that we are leaving behind is a community that has the heart of the patient. Good evening, good evening. Please, if you're a student on internship, just leave a comment and indicate. Let me know how many students are already on live. Good evening, good evening. If you are joining my live for the first time, I'm Nurse Aisha. Please take out some seconds of your time, like the video, leave a comment so that I might greet you from the direction and from your own home country. Where are you watching me from? Where are you watching me from? Just leave a comment so that I might extend my love and greetings into your own language. Good evening, good evening. Today we are going to be talking on the main topic, which is ectopic pregnancy. And from there we are going to be looking at how nurses penned down their report. How do we pen down report for old patients? How do we pen down report for new patients? Consultation, nurses consultation, reading planification as well as calculation of drugs. These are some very much important aspects in nursing, and no matter how you do it, you can't go around it. You must, as a nurse, write reports on each and every day when you're on duty. That is depending on how many persons are on duty. If we have 3 nurses on duty, then 1 person can be appointed to write the report. If we're having 4 nurses on duty, 1 person can be appointed and there can be rotation from one nurse to the other. Please leave a comment. I wish to give you my greetings. Let me know from which direction you're watching me so that I can greet you with regards to your own time. Here is in the evening. We are already past 8 o'clock. I guess somewhere else they might be late in the evening. My family from India, I say welcome. People from Pakistan, Bangladesh, I say welcome. Please, my live video might not be as fancy as those of others. I ask for your pardon and forgiveness. It is what it is. When we have waited for so long to grow, and we decide to grow without any instruments, we got to start where we are. Welcome to my live video. If you are a nurse, please indicate that you're a nurse. If you're a nursing student, indicate that you're a nursing student so I should know who I'm going to be talking with. Today we are going to be talking on ectopic pregnancy. Let's take the live to at least 20 individuals so that we can be talking with a large population. If you're having a question, please leave your question at the comment section so that I might attend to you directly. Oh, it's going to rain here. It might disturb the live, but let's pray it does not. Thank you very much for joining the live. Today we are going to be talking about report writing. As nurses, how do we pen down our reports? And what happened? How do you pen down a report for a new patient? And how do you pen down a report for a subsequent or for follow-up treatment? A patient that was already admitted in the hospital, how do you do follow-up report writing. How do we do consultation as nurses? How do we consult as nurses? As well as we are going to be looking at how to present our patients to the doctor. Good evening, good evening. Here is Nurse Aisha on the line. If you're joining my live video for the first time, I say welcome. So my students to struggle to meet up, we will start on ectopic pregnancy. Ectopic pregnancy is the implantation of the fetus outside the uterus. It could be an ectopic pregnancy that occurs in the abdominal cavity, that is the perineum, or it could be an ectopic pregnancy that occurs inside the fallopian tube. And most at times, the most common type of ectopic pregnancies are those that occurs inside the fallopian tube. This equally could be as a result of so many factors that comes into play. It might be caused by a narrowed fallopian tube or adhesions, somebody that has suffered from a previous scar of operation or adhesions, or this ectopic pregnancy can be as a result of early growth, blockage in the fallopian tube that causes the egg not to be implanted correctly inside the uterus. And when we talk about ectopic pregnancy, we are looking at what we would term as an acute abdomen, because the individual will come to the hospital with an acute abdomen and they will keep telling you, well, I have severe pains. And if it's already ruptured, they might have severe general abdominal pains that might impede or that might interfere with diagnosing the patient correctly. And equally, most at times when a patient comes to the hospital with ruptured ectopic pregnancy or an ectopic pregnancy and they are complaining of generalized abdominal pain, if analgesics are given, just immediately the patient comes into the hospital, it might equally interfere with the correct diagnosis of this patient, which will further prolong their period of stay in the hospital and might cause death. Now, if we are looking at the signs and symptoms, how do we identify that this individual is having an ectopic pregnancy? Because unlike other diseases, we will have a pelvic inflammatory disease, we will have menstrual cramps, we will have a typhoid, we will have enteritis, we will have gastroenteritis, or we will have gastric sepsis, or we have gastritis. All of these are going to present with signs and symptoms that are somewhat related to the signs and symptoms that somebody with pregnancy will present with. Now, when an individual comes to the hospital with an ectopic pregnancy, she might give this as the following signs and symptoms that she is experiencing that might help you direct on how to go about it. Now, when we talk about the presenting complaint of the patient, we will be looking at what brought the patient to the hospital. How did the person, how severe is the situation? How severe is the condition? How severe is the pain that they are into that led them to come to the hospital? For an individual suffering from an ectopic pregnancy, the first thing you will take into consideration, especially if it's a ruptured ectopic pregnancy, I can enter, but I can what? Sorry, one student is leaving me a message. The first thing that you are going to realize is that the patient will tell you, I am on my menses. When you ask when is your last menstrual period, they will indicate that they are on their menses. Okay, no, let me not start from systemic questioning. Let me start from presenting complaint. All right, let me start from presenting complaint. 1 minute, let me share the live video to someone. I'm sorry, it's not the best, but I will keep on trying and trying on the cable network. So please forgive me if the network has to keep going off and it is the end of the class. It is the end of the live. Thank you so very much for staying, for waiting for me. I do appreciate. No matter where you're watching from, I send my love, I send hugs. I hope that your day, your evening is peaceful, and that may this knowledge that we are going, as I earlier said, my name is Nurse Aisha. Today we are going to be talking about ectopic pregnancy. A patient with an ectopic pregnancy, what writing, then to your patient, if the patient, that is the patient that you admitted on that day, was already in the ward, which is follow up, how not planification, plan for a patient, just so every other thing. If you are still watching up to this time, I say thank you. Skipped the live yet, then truly one of my family members, I'm going to say thank you, much love. Best we remember and start all over with what is an ectopic pregnancy. An ectopic pregnancy, we have, it is an implantation of the egg. It is the implantation of the fetus inside or outside the uterus. It means if it is not inside the uterus, it is called an ectopic pregnancy. And the site in which an ectopic pregnancy can occur is the fallopian tubes and the perineum. So if the ectopic pregnancy occurred inside the perineum, it is equally termed an ectopic pregnancy. Now, what are the signs and the symptoms of an ectopic pregnancy? One, for an ectopic pregnancy, we are going to have severe abdominal pains. The abdominal pains is going to be at the level of the iliac region. It could be the right iliac or the left iliac, depending on which side of the body lies the implantation. So if the implantation was done in the left fallopian tube, we are going to be having severe abdominal pains at the left iliac region. If the implantation is in the right fallopian tube, we are going to be having severe pains at the right iliac region. I know that is a lot of medicine and people and many people might not understand, but if you are of the medical background, you are going to understand. And if you are not, I'm going to make a recap for every other person to understand on how you as an individual, as a lady, can identify in the house that right now I am no more suffering from menses. This has nothing to do with abdominal pains. This has everything to do with me conceiving the baby at the wrong position. Another signs and symptoms, the individual will present with fever. Now, not everybody or not every patient might have fever. Fever will come into play if the individual already has a ruptured ectopic pregnancy that has causes sepsis. Then the individual will have fever. We are equally going to be saying, we are equally going to be having menses. Most of these patients that come to the hospital for ectopic pregnancy are now coming after the pregnancy has ruptured. Only few cases are diagnosed when the patient when there is no rupture yet, except it is for an individual that has been expecting or has been waiting to have a conception, and immediately they realized that they did not see their menses, they went to the hospital. But most at times, the patient will miss their period, and then they will wait for 2, 3, or 4 weeks before they will come to the hospital after the reoccurrence of their period, maybe for 1 week, and they realize that it's not stopping. Then they come to the hospital. And when they come to the hospital, you're like, okay, we are going to do you a pregnancy test. The individual is going to tell you no. Because according to them, they believe that they are not pregnant since they are seeing their menses. We'll be having severe rebound tenderness. Severe rebound tenderness here is an aspect in which when you palpate the area of pain and you allow your hand, the individual feels severe, sharp pains. So the first thing is to take into consideration is to allow the person to identify the position in which they are feeling pain with their hand. The next signs and symptoms we are going to be looking at is upon inspection or upon examination, there will be blood in the pouch of Douglas. So when you do your examination, the pouch of Douglas is the area that is behind the uterus, and it is behind the uterus and before the rectum. So it is in the space between the uterus and the rectum. We are going to have that empty cavity, yes? People should stop disturbing. We are going to have that empty cavity that is between, use it, that is between the uterus and the rectum, which is part of the perineum. So when there is rupture ectopic pregnancy, the pouch of Douglas will accumulate pus or will accumulate pus and blood if it is a ruptured ectopic pregnancy. Now, most at times, this is there is a misdiagnosis because they will say that it is a complete or a spontaneous abortion that is complete or it is incomplete. But you need to first of all rule out any possibilities of an ectopic pregnancy. And the important questions to ask this patient is, when do you start having pain? When do you start having pains? And how does the pain get aggravated? Now, this is because if the individual sits and they'll tell you, I have been having menses for the past 2 weeks, But I realized that at some point in time, the menses do not flow. Israel, I said no noise. At some point in time, the menses do not flow. They stopped. Maybe I want to lift up an object. I feel like I have a gorge of blood that comes out in the vagina. And the person is wondering, is it still menses? Am I still having menses? And sometimes they just like, okay, there are a lot of problems. Women have a lot of problems, and it might be this or it might be that. Hello, you need to be sure that it is not an ectopic pregnancy. If you want to lift up a heavy object and the first thing you have is a gorge of blood, there is a possibility that you're having a ruptured ectopic pregnancy. And when we go now to diagnosing, we will realize that the pregnancy test is positive. If this individual has been bleeding for a period of time that is more than 2 weeks, it is not a spontaneous abortion or incomplete abortion, and the pregnancy test is still positive, that is associated with severe pain at a particular position, it is a call for concern. Because a ruptured ectopic pregnancy, it is an emergency that requires immediate medical intervention. The surgeon should be informed, the medical practitioner should be informed, the surgical team should be informed, so that all these people, in collaboration with the nurses, can work together to make sure that we save a life and we preserve a family lineage and not lose the baby and the mother at the same time. So these are some of the important aspects that you need to see and you need to observe in yourself as a lady, and equally in somebody else, in your sister, in your brother's wife, to be able to help them. Because when this bleeding starts, it starts like normal menses. Now, when it progresses, you are going to realize that why you have a gorge of blood, because you are trying to do something, it comes with fluid, clear fluid that is odorless. And then you're wondering, but I did not urinate on my body, so how come I'm having fluid mixed with blood, and the fluid sieved to the particular extent while leaving blood on a particular portion? You are having a ruptured ectopic pregnancy. Go to the hospital. Get yourself checked. That is how we are going to see. Most of the patients will always come, I have severe abdominal pain. And they will tell you nothing more. And when you start asking, Mama, when is your last menstrual period? She will say, actually, I'm on menses. When did it start? Actually, that is where the problem starts, because that is when they will tell you, I don't understand what is happening with me this time around. I say, you're supposed to shut up. I'm sorry, the children are disturbing. That is when, please, you push stop noise. I'm serious. I will kick you inside that room. The individual will indicate that I started my menses 2 weeks ago or 3 weeks ago, and I'm just realizing now that it's been so long. Maybe I was told that maybe I'm having PID, that is pelvic inflammatory disease, and that might be the reason for which I am having prolonged period of menstruation. And they probably have taken some traditional medications. They have gone to the pharmacy to get some over-the-counter medication to use, and realize that none of that is helping. And that is why they are in the hospital. They have pain. You need to see into it that you are able to help them manage your, I'm seeing your shadow here. You are able to help them manage the situation in the best possible way. Now let's go to diagnosis. If we want to diagnose a patient with ectopic pregnancy, how do we go about it? Where do we start? Now, the first thing for us to understand is that it is very important for us to ask for the following test examination. You ask for individual a pregnancy test, which should be a must. You don't have to listen to the person tell you that I'm seeing my menses, so there is no need for me to do a pregnancy test. You need to counsel the patient on the importance of conducting a pregnancy test. You need to equally check on their full blood count. Their full blood count is going to help you to rule out that there is no bleeding, because if the person has been bleeding for the past 2 weeks or 3 weeks, then there is a possibility that they are running anemic, and that result alone will make you to realize that there is an internal bleeding actively going on. We are equally going to look at the white blood cells to check if the white blood cells are elevated. How do we manage a situation in which the white blood cells are elevated? And this as well is going to help you to see how to manage it in the best possible way. Knowing antibiotics to add, when to add it, and how to go about them. From there, we are going to be asking for an emergency echography, because only the echography is going to help us confirm the diagnosis that we are suspecting. Now, sometimes before you send the patient for an echography, you have done a vaginal examination. And for the vaginal examination, we are going to realize that the cervix is closed. If the cervix is closed and the individual is bleeding, and there is a pregnancy test that is positive, it is a call for concern to make you understand that, please, Gosha, instead of indicating that you're here, please, you guys should leave your comments. Leave your comment. If you're students on internship, leave your comment. Please keep commenting so I know who and who are in class presently. So you go ahead and you see that your diagnosis be confirmed. When the diagnosis is confirmed of an ectopic pregnancy, medical doctors, surgeons, and every member of the team is supposed to be proactive to ensure that everything goes on smoothly and the patient is in the best state of mind. Now, when we go to talking about the pre-preparatory for surgery, we are going to be looking at what are we supposed to be preparing to send this patient for surgery. Number one, I already said we need an NFS. We need to know if this patient is anemic. And if the patient is anemic, we need to be sure that we make preparation for them to have bags or a bag of blood ready for transfusion during the period of interoperative phase. As well as we need to check on the sugar level, we need to check on the creatinine levels, we need to check on the bleeding and the clotting time. You need to check that the clotting time is good enough, because you are going to enter into an individual's abdomen. You don't want a situation whereby you are going to be faced with excessive bleeding for an individual who is already having problems with anemia. That is for the preoperative phase. We have to put in a catheter, that is the urinary catheter, the cannula, and we have to put in the cannula, the urinary catheter. We have to counsel the patient on signing the consent form. We have to as well be sure that the fee and the price for operation is paid. These informations are very vital informations. We need to be sure that there is somebody that is ready. We need to check the patient's blood group. It should be checked and confirmed. This is to delay, this is to prevent any deliriums in situations whereby they need an emergency blood. They need an emergency blood. So you just need to be sure that there's somebody that is ready to give in this blood in case it is 100% needed. I was distracting. Sorry. So these are the few things you need to consider or to put in mind when you are taking this patient to the theater. You need to be sure that the doctor is going in there. He has everything. I will slap you if you don't keep quiet. Sleep and stop disturbing. We have to make sure that the surgeon is going into the theater and to be able to have the best experience and get into the abdomen and control the bleeding and take everything out and then take care of the patient to send them back to us. And then when we are looking at the post-operative phase, here we are talking about rehydration. You're rehydrating the patient, giving on antibiotics, giving of analgesics, and keeping to time and making sure that each of these treatment is prepared the way it's supposed to be and the best medical care is given to the patient. We are checking on the urine we are checking on the input and the output. We are checking on the vitals. Remember that when a patient comes out from the theater, for the very first hour we are checking the BP after every 15 minutes. So you are checking the BP and the pulse after every 15 minutes, and after 1 hour we'll be checking after every 30 minutes, and then after every hour for the next 4 hours until we realize that the patient is completely stable. Number 2, we will be checking on the patient's input and output. Input with relation to the output, because if you are going to give that patient 2,000 cc's of normal saline or ringers, you want a situation in which I will beat you. Sleep. Are you tempting me to beat you this evening? Swine. You want a situation in which you are going to be evaluating the input. If you give that patient 2,000 cc's of normal saline, what is the exchange? If you give that patient 2,000 cc's of normal saline, what are you expecting as urine output? To the room. To the room. What are you expecting as the urine output? And when you get the urine output, if you realize that you are rehydrating the patient for 2,000 or 3,000 or 4,000 cc's, and you have as output only 50 cc's, then there is a problem with the rehydration. There's a problem with probably the kidneys or something. You need to start finding out. What next you are supposed to be intervening. You need to start calling the doctor or the surgeon to see that the best medical practice can be offered to this person. So yes, ectopic pregnancy is a big deal. It's a very, very big deal. Sleep. Many women have it in mind, if I have an ectopic pregnancy, will I be able to have a child in my later days if I get married? Or now that I'm married and I had my first pregnancy to be an ectopic pregnancy, will I be able to conceive again? Maybe because one of the fallopian tubes were removed, why the other was not? The answer is yes. You are able to deliver, because if they are looking at one side of your fallopian tube, you still have the other side to help you to conceive. So no, it does not mean that because you had an ectopic pregnancy, that simply rules you out from the beautiful women to be called a mother. You too can be a mother. So fear not. You just need to give it to God and He will do it in His own perfect timing.